Question. Myasthenia gravis is primarily caused by options A. Demyelination of peripheral nerves, B. Autoimmune destruction of acetylcholine receptors at the neuromuscular junction, C. Deficiency of dopamine in basal ganglia, D. Degeneration of myelin in CNS. The correct answer is option B. Autoimmune destruction of acetylcholine receptors at the neuromuscular junction. Myasthenia gravis is an autoimmune disease where antibodies target and destroy acetylcholine receptors at the postsynaptic membrane of the neuromuscular junction, leading to impaired muscle contraction and muscle weakness. Question. The hallmarks clinical features of myasthenia gravis is options A. Muscle rigidity, B. Muscle weakness that worsens with activity and improve with rest, C. Sensory loss, D. Spastic paralysis. The correct answer is option B. Muscle weakness that worsens with activity and improve with rest. This classic symptom, fatigable muscle weakness, means that strength decreases with repeated or sustained activity but recovers after a period of rest. Question. Which of the following test is considered diagnostic for myasthenia gravis? Options A. MRI of brain, B. Tensilon or edrophonium test, C. Complete blood count, D. Nerve conduction study. The correct answer is option B. Tensilon test or edrophonium test. This test involves administration of edrophonium chloride, which inhibits acetylcholinesterase, increases acetylcholine availability at the neuromuscular junction, and temporarily improves muscle strength in patients with the myasthenia gravis. It is used to confirm the diagnosis, especially when clinical signs like ptosis or muscle weakness are present. Other tests supportive of diagnosis but not listed as options here include blood test for acetylcholine receptor antibodies and electromyography. Question. A common early symptom of myasthenia gravis is options A. Difficulty swallowing, that is dysphagia, B. Tremors in hands, C. Loss of sensation in limbs, D. Back pain. The correct answer is option A. Difficulty swallowing, that is dysphagia. Early symptoms often involves weakness of the eye muscles, that is drooping eyelids, double vision, and muscles controlling facial expression and swallowing. Dysphagia is common as bulbar muscle weakness progresses, affecting speech and swallowing. Question. Which of the following is the first line treatment for myasthenia gravis? Options A. Dopamine agonist, B. Acetylcholinesterase inhibition, example pyridostigmine, C. Corticosteroids only, D. Beta blockers. The correct answer is option B. Acetylcholinesterase inhibitors, example pyridostigmine. Pyridostigmine is an acetylcholinesterase inhibitor, is the primary initial therapy used to improve neuromuscular transmission by increasing acetylcholine at the neuromuscular junction, thereby alleviating muscle weakness symptoms. Corticosteroids may be added in cases with inadequate responses or more severe diseases, but are not typically the single first-line agent. Dopamine agonists and beta blockers are not used in myasthenia gravis treatment. Question. A myasthenia crisis is options A. Sudden sensory loss, B. Severe muscle weakness leading to respiratory failure, C. A type of seizure, D. Acute joint inflammation. The correct answer is option B. Severe muscle weakness leading to respiratory failure. A myasthenia crisis is a life-threatening complication of myasthenia gravis characterized by severe weakness of the respiratory muscles, which leads to respiratory insufficiency, requiring medical interventions such as mechanical ventilation. Question. Nursing priority for a patient with myasthenia gravis include options A. Encouraging heavy exercise, B. Monitoring respiratory function, C. Avoiding all medications, D. Restricting fluids. The correct answer is option B. Monitoring respiratory functions. Monitoring respiratory function is crucial because patients are at risk for respiratory failure due to weakness of the respiratory muscles, especially during a crisis condition such as a myasthenia crisis. Nurses must vigilantly assess breathing, airway patency, and signs of respiratory distress to intervene promptly if necessary. Encouraging deep breathing, maintaining suction readiness, and assessing for signs of respiratory compromise are essential components of comprehensive care for myasthenia gravis patients. Question. Ptosis in myasthenia gravis worsens with options A. Rest, B. Physical activity, C. Sleep, D. Cold. The correct answer is option B. Physical activity. Question. Diplopia occurs due to options A. Optic nerve damage, B. Ocular muscle weakness, C. Retinal detachment, D. Lens opacity. The correct answer is option B. Ocular muscle weakness. Weak extraocular muscle causes misalignment of the eyes, resulting in double vision. Question. Positive tensilon test shows options A. Muscle weakness improves temporarily, B. Reflexes disappears, C. Sensory loss decreases, D. Tremors worsens. The correct answer is option A. Muscle weakness improves temporarily. Question. Blood test used in myasthenia gravis diagnosis. Options A. Anti-dsDNA, B. Anti-acetylcholine receptor antibodies, C. Creatinine kinase, D. ESR. The correct answer is option B. Anti-acetylcholine receptor antibodies. It detects autoantibodies responsible for myasthenia gravis. Question. Imaging to detect thymoma in myasthenia gravis. Options A. MRI brain, B. Chest X-ray or CT scan, C. Ultrasound abdomen, D. ECG. The correct answer is option B. Chest X-ray or CT scan. Chest X-ray may be used initially, but CT scan of the chest is the imaging procedure of choice for detecting thymoma in patient with myasthenia gravis. CT provides detailed visualization of the anterior mediastinum where the thymus is located and helps identifying thymic tumor or hyperplasia. Question. Common triggers for myasthenic crisis. Options A. Excessive sleep, B. Infection, stress, surgery, certain medications, C. Hypothermia only, D. Low carbohydrate diet. The correct answer is option B. Infection, stress, surgery, certain medications. Myasthenic crisis is often precipitated by factors such as respiratory infections, especially pneumonia, physical or environmental stress, surgical procedures, pregnancy, certain medications, including some antibiotics and anesthetics, and tapering of immunosuppressive drugs. These triggers causes worsening of muscle weakness leading to respiratory failure is a medical emergency. Question. Differentiating myasthenic versus cholinergic crisis. Options A. Both worsens with edrophonium, B. Both improves with edrophonium, C. Edrophonium improves weakness in myasthenic, worsens in cholinergics, D. No effect. The correct answer is option C. Edrophonium improves weakness in myasthenic, worsens in cholinergics. In myasthenic crisis, edrophonium, a short-acting acetylcholinesterase inhibitors, improves muscle weakness by increasing acetylcholine availability at the neuromuscular junction. In contrast, in cholinergic crisis, which occurs due to excessive acetylcholinesterase inhibitors use causing acetylcholine accumulation and receptor overstimulation, edrophonium worsens symptoms due to further acetylcholine excess. This difference is used clinically to differentiate between these two crises. Question. Bulbar symptoms in myasthenia gravis. Options A. Muscle rigidity, B. Dysphagia, dysarthria, nasal speech, C. Loss of reflexes, D. Visual field defects. The correct answer is option B. Dysphagia, dysarthria, nasal speech. Bulbar symptoms refers to weakness in the muscles innervated by the brainstem, that is bulbar muscles, affecting speech, swallowing and chewing. Patients often experiences difficulty swallowing, that is dysphagia, slurred or nasal speech, that is dysarthria, and hoarseness. These symptoms can significantly impact nutrition and airway safety and are important clinical features of myasthenia gravis. Question. Nursing intervention to reduce fatigue in myasthenia gravis. Options A. Encourage long continuous activity, B. Limit rest periods, C. Schedule activities in the morning, D. Avoid physiotherapy. The correct answer is option C. Schedule activities in the morning. Strength is usually better in the morning. Rest periods prevent exhaustion. Question. Plasmapheresis in myasthenia gravis is used for options A. Stimulating acetylcholine, B. Increasing long-time muscle strength, C. Rapid removal of circulating antibodies, D. Treating tremors. The correct answer is option C, rapid removal of circulating antibodies. Plasmapheresis, also called therapeutic plasma exchange, that is TPE, is an extracorporeal procedure that removes the plasma portion of the blood containing pathogenic autoantibodies, including those against acetylcholine receptors. This results in a rapid decrease of circulating antibodies, leading to short-term improvement in muscle strength and symptom relief in myasthenia gravis, especially during myasthenic crisis or exacerbation. The effect is rapid but usually temporary, and plasmapheresis is often combined with immunosuppressive therapies to maintain long-term control. Therefore, the primary role of plasmapheresis in myasthenia gravis is to quickly remove circulating antibodies. Question: thymectomy is indicated in myasthenia gravis patients with options A. Ocular MG only, B. Thymoma or generalized myasthenia gravis, C. Cardiomyopathy, D. Diabetes. The correct answer is option B. Thymoma or generalized MG. Thymectomy is recommended for all MG patients with thymoma, as surgical removal is essential due to the tumor. It is also considered beneficial for patients with generalized myasthenia gravis who are antibody positive, especially acetylcholine receptors antibody positive, to improve clinical outcomes and reduces medication dependence. However, thymectomy is not generally indicated for ocular MG alone, and comorbidities like cardiomyopathy or diabetes are not direct indication for thymectomy in MG. Question: common side effects of pyridostigmine. Options: A. Hypertension, B. Diarrhea, abdominal cramps, increased salivation, C. Hair loss, D. Tremors. The correct answer is option B. Diarrhea, abdominal cramps, increased salivation. Pyridostigmine is an acetylcholinesterase inhibitor used in myasthenia gravis to improve muscle strength. Its cholinergic side effects are primarily gastrointestinal and include diarrhea, abdominal cramps, nausea, increased salivation, sweating, and muscle cramps. These side effects result from increased acetylcholine stimulation of muscarinic receptors in the gut and secretory glands. Question: eye care for patients with ptosis in myasthenia gravis includes options A. Encourage rubbing eyes, B. Use artificial tears and tape eyelids during sleep if needed, C. Limit blinking, D. Apply cold packs continuously. The correct answer is option B. Use artificial tears and tape eyelids during sleep if needed. In myasthenia gravis, ptosis causes incomplete eyelid closure, leading to dry eyes and a risk of corneal irritation or damage. Artificial tears helps lubricate and protect the eyes. If eyelid closure is inadequate, gently taping the eyelids closed during sleep can prevent exposure keratitis. Question: first symptoms often noticed in myasthenia gravis. Options: A. Limb paralysis, B. Drooping eyelids, that is ptosis, C. Loss of sensation, D. Tremors. The correct answer is option B. Drooping eyelids, that is ptosis. Question: which muscle group is least affected in early myasthenia gravis? Options: A. Ocular, B. Facial, C. Limb muscles, D. Bulbar muscles. The correct answer is option C. Limb muscles. Limb muscles are usually affected later. Ocular and bulbar muscles are involved first. Question: repetitive nerve stimulation RNS in myasthenia gravis shows options A. Incremental responses, B. Decremental responses, C. Normal response, D. Fibrillation only. The correct answer is option B. Decremental responses. RNS is a diagnostic test for neuromuscular junction disorders like myasthenia gravis. It involves repeated electrical stimulation of a motor nerve and recording the muscle response. In myasthenia gravis, there is a characteristic decremental response where the compound muscle action potential, that is CMAP, amplitude progressively decreases with repetitive stimulation due to fatigable transmission failure at the neuromuscular junction. Question: EMG finding in myasthenia gravis. Options: A. Increased muscle tone, B. Decremental response at low frequency stimulation, C. No change, option D. Fibrillation potential only. The correct answer is option B. Decremental response at low frequency stimulation. Question. Pyridostigmine improves muscle strength by options A. Increasing acetylcholine breakdown, B. Inhibiting acetylcholine esterase, C. Stimulating nerve growth, D. Suppressing autoantibodies. The correct answer is option B. Inhibiting acetylcholine esterase. Question. Myasthenic crisis most commonly affect which system? Options A. Cardiovascular, B. Respiratory, C. GI system, D. Nervous system. The correct answer is option B. Respiratory system. Question. Nursing intervention for patients taking pyridostigmine. Options A. Administer 30 to 60 minutes before meals, B. Give with the empty stomach only, C. Avoid water, D. Give at night only. The correct answer is option A. Administer 30 to 60 minutes before meals. Pyridostigmine should be given about 30 to 60 minutes before meals to improve muscle strength for chewing and swallowing. This timing optimizes the drug effect during eating, preventing aspiration and improving nutritional intake.